And so when we talk about the ABLE account, when I talk about the ABLE account, I usually provide a very brief overview and then compare a special needs trust and an ABLE account. And it's because my world is special needs trust, right? I love to educate and I love to get out there and speak about special needs trust. But I also know that they're not for everybody, right? For whatever reason, they're not going to be the best option for somebody. And so we want to talk about the ABLE accounts. I've been following the ABLE accounts since 2012 when they were just a whisper, right? And then they passed in 2014. Missouri opened the ABLE account. Their first one was open in 2016. And so ultimately, when you boil it down, the ABLE account is a financial planning tool, right? I always said that already. I said that about special needs trust, right? An ABLE account is an alternative to a special needs trust. It is very, very similar to a 529 savings plan in fact, it's called a 529A, right? And that's from the IRS. And so the IRS said, oh, we already have this savings plan over here. It's called a college 529 plan. Why don't we just use some of the same rules, the same regulations, the same kind of stuff and apply it to this ABLE account thing? And so that's what they did, right? So they call it a 529 savings account. Individuals must be considered disabled before the age of 26. That rule is changing in the future. It's going to go up to 46, but right now, which is our concentration today, individuals must be considered disabled before the age of 26. And when I say considered disabled, I mean either they have been deemed disabled by the Social Security Administration or have been certified by a doctor. That does not mean that they have to be 26 when it opens, right? Anybody of any age can open an ABLE account as long as they were considered disabled before the age of 26, either by disability determination from the Social Security Administration or by certification from a doctor. My next bullet you'll find is one account per person. So when we talked about multiple accounts just a few moments ago, multiple special needs trusts, it's not true here, right? One account per person. Up to $18,000 in deposits per year. This is based off what's called the gift tax exclusion. It can change every year. So right now, it is $18,000 in deposits per year. And I know some folks are saying, oh, but she's missing that one thing, right? So if an individual is working, and they do not have their job does not offer a retirement plan, they can add funds up to, oh, somebody's going to do the math for me, about 25,000 into their ABLE account of their wages, right? So they can utilize the ABLE account as a retirement account essentially and say, well, I already put 18,000 in and my job doesn't offer a retirement plan. I can put more money in. That option is only available to those who are working. And as our questions were asked earlier, it talked about moving funds from a first party trust to an ABLE account. And we'll talk about how that is absolutely possible, but they wanted to do it to avoid that Medicaid payback provision. ABLE accounts have a Medicaid payback provision. So Medicaid is still going to get paid after the beneficiary passes in an ABLE account. And you can't really see it on my slide here, but if there is a link and it's www.moable.com. That is the link for more information about the ABLE account. So on this slide, we're going to get out our highlighters. We're going to talk about what we should highlight here, right? So the first one is individuals must be considered disabled before the age of 26. Let's walk away with that, right? So if we have somebody in our life and there is a tragic accident, they're 35 years old. What are they going to do? They can't open an ABLE account, right? Because they were not considered disabled before the age of 26. It is also one per person. Can't have multiple ABLE accounts. And then the third thing we're going to talk about, we're going to do three things. Sometimes I do two. We're going to highlight three on this slide. The third one is there is a maximum amount of deposits per year. There's also a maximum account value to when your Social Security is suspended. And I talk about that in a minute, as well as a maximum account value over the lifetime. So a couple of differences between the special needs trust, and we're going to look at the comparison here. So like I said, I really love to talk about special needs trust. I really love to talk about ABLE accounts. And when you put them side by side, ultimately, their purpose is the same. Their purpose is to protect the public benefits of individuals with disabilities. So special needs trust is established by a parent, grandparent, guardian, court, or person with a disability. But an ABLE account is established by the individual with a disability or their responsible party. With a special needs trust, there's no age limit, right? You don't have to be considered disabled by a certain age. You can open a special needs trust at any age. I won't get into the technicalities. There is a 65 and older, it becomes a little complicated. But an ABLE account, you can open it at any age as long as you're considered disabled before the age of 26. There are two types of special needs trusts. We have first party, Johnny's money, Medicaid payback. We have third party, donor's money, no Medicaid payback. And with the ABLE account, no matter whose money it is, doesn't matter. It could be Johnny's and it could be mom and dad's and it can be grandma's. It's all going into one pot and there will be Medicaid payback at the end. The wonderful thing about all of this, right? The wonderful piece that we're walking away with tonight is that it is considered an exempt asset for SSI, Medicaid, food stamps, and HUD housing, right? If we take nothing from what I said, we're going to take away that special needs trust and ABLE accounts are an exempt asset for SSI, Medicaid, food stamps, and HUD housing. So you'll see my little note there on ABLE account. SSI, you can have an ABLE account. Somebody can have an ABLE account up to $100,000. At $100,000, SSI said, Social Security says, oh, you have too much money. We're going to suspend your SSI, not terminate, not shut it off completely, right? It's still available if the ABLE account were to reduce in balance, but it gets suspended, which means there's no more funds available from Social Security until the ABLE account reduces in its value. So with SSI, it gets suspended at $100,000. With a special needs trust, you have a trustee making decisions, right? And we are all for making our own decisions, right? We are all for supported decision making and doing what we need to do for our best life, right? But with a special needs trust, there is somebody making the decisions on how the funds should be used, on how they're administering the trust. So they're making investment decisions. They're ultimately deciding how the funds will be used, but they're also following the many, many, many rules listed by Social Security and Medicaid. An ABLE account has less rules, but it's also the individual's responsibility to make decisions. There's not much oversight with the ABLE account. You're accountable to the IRS. You're accountable to Social Security, and distributions that are not correct may have a tax implication, but no one's making those decisions for someone. With a special needs trust, there are no yearly max contributions or max limits on the account balance. You can make deposits every day, all day, for as long as you want, and as much amount as you want. With an ABLE account, there are yearly max contribution limits and a max limit on the account balance. In Missouri, it's like $529,000. So Medicaid is going to say you can have an ABLE account. Absolutely. You can have it even over $100,000. ABLE account is going to say your max limit over your lifetime. So the max you can have in an ABLE account is $529,000. But your SSI got suspended at $100,000. So I want to stop right here, and we'll take some questions here in just a moment. I want to spend some time on this because the next piece that I'm going to talk about is distributions, but I want to make sure that before we get to that piece, we know the difference of a special needs trust and an ABLE account. So I highly recommend ABLE accounts. Like I said, I've been following them for over a decade. I think they're wonderful tools in our toolbox. They can do so much for individuals with disabilities. But just like a special needs trust, an ABLE account may not always be appropriate, right? So whether that be due to age or due to disability, or maybe a little more oversight is needed, or we can't have that SSI suspended at $100,000. Maybe that's a scary thing. Or donors don't want a Medicaid payback, right? They don't want anything to do with that. So we really need to consider when we're talking about special needs trust and ABLE accounts, what their purpose is, which is always to protect the public benefits of the individual with a disability. But what do they do? What are their limitations? What are their advantages? What is our plan for these funds? And so I want to stop here before we jump into distributions and take as much time as we possibly need for special needs trust and ABLE account questions. I know that oftentimes, I know I was asked today at an event probably 5 times if they're the same program. They're not, right? But they do serve the same purpose. And so let's work through our questions. Let's get those out in the open and discuss as needed.
Someone said, I notice you have said that a trust should be written a certain way. Are there things that we should know and look out for when having a trust created not by another financial establishment?
Yes. So if you're going to an attorney, you're going to want to ask, have they written a special needs trust before? And that may sound like a really silly question, but I'll tell you the number of attorneys that are going to say, nope, never done it. Right? You don't want that attorney to write your special needs trust. You want to find an attorney that has written lots and lots and lots of them, that is well versed on how to write a special needs trust because of the technical language that is needed. The advantage to using a pooled trust, and I'm not going to sales pitch you on what we do and how we do it and why we do it, but what I am going to tell you is that if you use an organization like Midwest Special Needs Trust, our trust documents are already written, they're already approved by Social Security, and per state statute, Medicaid is required to exempt them. So you're going to want to look for an attorney and a trustee that has the knowledge base and the skill set to write a special needs trust document and that can then administer it in accordance with the rules. Because again, both the document and the distributions must be done correctly for the special needs trust to be considered an exempt asset. So if you're working with an attorney and they say, nope, I've never written a special needs trust, you might want to just look around. And I don't make referrals, but I can provide a list to you. And I know the St. Louis Arc does as well. They have a list of attorneys that do well in the special needs trust world. And so you always want to make sure your attorney knows about special needs trust planning or special needs planning and special needs trust in particular.
So someone else says, would it be beneficial to start the ABLE account as soon as your child is diagnosed, so that you have more years to add money to that account?
I think that's a great idea. I know families that do that with the 529, right? They have their little ones and they're already contributing to their college fund. Parents, individuals with disabilities, our kiddos might go to college, right? We want to save for them in their future. So the ABLE account allows for us to do that. And so we can put funds into the ABLE account starting whenever you want to build up that for their future. I think that's a great idea.
And this question came to mind when speaking about wages. Does the 401k count as an asset for Social Security?
Absolutely. Yep.
Thank you.
Mhm.
When parents pass away, how can a caregiver get access to funds faster? ABLE account or third-party special needs trust?
Oh, that is a really good question. So I can answer the third party. caregiver must be named in the trust document. Otherwise, no trustee is, or bank or anybody is going to talk to them, right? So if you have a caregiver who has not been named in your trust agreement, that caregiver is not going to be able to access those funds. With the ABLE account, it is the beneficiary is in charge of it, right? Or their responsible party. And so I don't know how technical the ABLE account gets, that if they recognize all kinds of roles like guardian and rep payee and whoever is serving in that role would have access to the funds, or if they have a different set of rules. Um, Interesting question. I can look that up. Actually, I will probably go home and look it up. But my guess is that they probably recognize whoever is in a responsible party role. So if you're rep payee, they will you'll be able to have access to those funds if needed.
Great, thank you so much.
Mhm.
Can ABLE account funds be used to buy a burial policy for the beneficiary?
Oh, we're going to talk about my very favorite thing soon. So, to answer your question, yes. But you'll hear me talk about burial policies in just a little bit.
Great. Someone says, my child is 19 and lives at home for now. He has earned $13,000 so far this year. If he opens up an ABLE account and puts part of his paycheck per pay period in the ABLE account, could he then qualify for benefits?
So it is still going to count as income to him. So, and you said 13,000 in income?
Yes.
Okay. So it's still going to count as income, even if he does something with it the day, he receives it. So, likely, like you can't bypass income, right? So it's still the beneficiary's income. It's still the recipient's income. It just may not be going into their checking account unless it, is a third party, and then it gets kind of redirected to the special needs trust, but income to the beneficiary is always income. I do think it's a great idea to utilize an ABLE account, especially at 19 and start saving, but you can't kind of uh, bypass the income calculation to the beneficiary or to the recipient.
Thank you. What if the person has Social Security and not SSI, just keeping Medicaid happy with the ABLE account to keep the separate checking account low on enough for assets?
Sure. I think that's a great idea. So a special needs trust, if someone calls and they say, Casey, I need a special needs trust, my son receives SSDI and has Medicaid, I'm gonna say, I think that's great. But the asset limit for Medicaid is so high, right? So we don't necessarily need to protect an asset limit necessarily, because the Medicaid asset limit is 5,900. With SSI, our concern is the asset limit of 2,000. So I think utilizing an ABLE account to kind of keep the checking account low is a great idea. And that way he can use it for certain things and use his checking account for other things. I think that's wonderful. I'm just going to kind of repeat what I've already said. So we started our evening off talking about government benefits, right? We started our evening talking about what means tested and not means tested means. And we learned that means tested is SSI, Medicaid, HUD housing, and food stamps. We walked away knowing that those are going to be means tested, that income and assets are what are counted, right? Then we moved on to our special needs trust, and we learned that special needs trust protect public benefits if properly written and properly administered, right? And we learned that Johnny has his own special needs trust. It's his own money. And when he passes, Medicaid has a Medicaid payback provision at the end, right? They get it at the end. We learned that mom and dad have a special needs trust for Johnny. It's their money. There's no Medicaid payback provision at the end, but both of them are considered exempt assets, right? They're considered exempt assets for SSI, Medicaid, food stamps, and HUD housing. Then we jumped to an alternative and we talked about ABLE accounts. We said, oh, we don't need a special needs trust, or that's not in our plan right now. Johnny's working and he's putting a little bit in the ABLE account every month, and that's wonderful, right? The ABLE account has the same purpose as a special needs trust. That purpose is what? It is to protect the public benefits of an individual with a disability, right? It's going to protect that SSI, that Medicaid, that food stamps, that HUD housing. And I know I repeat myself quite a bit, and it's because I really want to drive home the fact that SSI and Medicaid are important public benefits. They're a monthly income. Medicaid provides all kinds of things for individuals with disabilities, right? In some instances, it's housing and transportation, their waiver services, medical care, pharmacy, all covered by Medicaid, right? It is so important to protect those benefits, whether we do that through a special needs trust or through an ABLE account. And the important piece we take away with the ABLE account is that there is an age limit of when the person must be considered disabled. You can open it at any age. It must be considered before the age of 26. One account per person. There's a maximum contribution limit each year. And there is a Medicaid payback at the end. So now that we've done all of our re-highlighting of our papers, right? We've sat in class, we've learned, we underlined all of our notes. We're going to learn something new. We're going to turn the page. We're going to talk about distributions. I am going to get into the nitty gritty of this, but this is just a really fun graphic. And so if you need a quick, oh, what did she say about that one thing graphic, this is going to pull it off for you. So distributions from a special needs trust and an ABLE account really are very, very similar, right? We see medical on both. And if I had my red laser pen, I could highlight for you. We see medical on both. We see dental on both. We see clothing. We see transportation. We see cell phones. We see vacation. And we see education on both of them, right? Except on the ABLE account, I have a house instead of arts and crafts. ABLE accounts can still pay for arts and crafts, but I don't have a house on the special needs trust. And we're going to learn why here in just a few minutes. So if you're looking at this and you're going back through and you're saying, oh, she said something about ABLE accounts and special needs trusts and the importance of planning for our loved one with a disability and protecting those public benefits and the distributions. What did she say about distributions? You can come to this page, you can come to this graphic and say, oh, that's right. Special needs trust can't pay for housing, but ABLE accounts can. So we're going to talk about that. We're going to talk about the distributions between an ABLE account and a special needs trust. But use this graphic, use it to kind of help you understand what you're going to use the funds for. The other, I just noticed it. The other graphic I have, the other icon I have is groceries under the ABLE account. I don't have groceries under special needs trusts. Why doesn't she have groceries? It's because special needs trust can't pay for groceries, right? So we're going to talk about that. But if you come to this graphic and you say, I think I'm going to have to utilize the ABLE account. Johnny needs to have his rent paid. He needs to have his food paid for. Great. I love that. That's a perfect use for the ABLE account. But if you're looking at it and you're like, oh no, he's on the waiver services and his housing is taken care of and we don't have to worry about this, and this, and we want the special needs trust to be used for these things, maybe a special needs trust is more appropriate. And so we're going to talk a little bit about allowable distributions. So allowable distributions from a special needs trust, this is not an exhaustive list. I'm going to tell you now, I can pay for lots and lots and lots of things. A trustee of a special needs trust can pay for many, many things. The allowable list includes medical, dental, and therapies. And so what I say on this is that if you've been around a really long time, like I have been around nearly 20 years working in with individuals with disabilities and public benefits and special needs trust administration, you'll know Medicaid hasn't always covered dental, right? It wasn't up until about 10 years ago they started covering dental again. And so Medicaid can take away dental at any time. I don't know if they will. I don't know if they won't. But who's going to pay for those dental expenses if there isn't a special needs trust to supplement that cost? Maybe our loved one is a wheelchair user, right? I used this example earlier today, and Medicaid's going to cover a wheelchair. Great. It is going to be the most basic, boring wheelchair you could possibly find, right? They're going to cover the lowest cost option. Special Needs Trust can buy the fanciest option for a wheelchair user, right? All of the bells and whistles, all of the motorized things, all of the safety, every mechanic that's out there for wheelchairs can be purchased with a special needs trust. So yes, Medicaid's going to cover a wheelchair, right? They're going to cover durable medical equipment and probably some physical therapy and maybe some other things. But is it what the beneficiary wants? Is it what the donor's intent is? Do they want something fancier? Do they want something just a little bit higher quality for their loved one? A special needs trust can do that. Education expenses. So one of my very, very favorite things to do is to send young adults and adults who are returning to college to go to school, right? We encourage folks to go to school, to live their dream, to live their best life, right? And so education expenses are always covered in a special needs trust. And I say that knowing that as long as there are sufficient funds in the special needs trust, then we can pay for all of these things. I'm going to skip irrevocable prepaid burial policies. I'm going to come back to them though. Clothing is an allowable expense, non-food grocery items. So toilet paper, paper towels, cleaning supplies, pens, paper, all of that is an allowable expense. And I highlight non-food, right? Food is not an allowable expense. Transportation, this includes vehicle, fuel, and modifications. So we oftentimes buy modified vehicles for our beneficiaries, typically through United Access or whatever other organization or agency has that kind of vehicle for our beneficiaries. Whether that be they need a ramp to get into the vehicle, or they need specialized equipment to be able to drive the vehicle. All of that is an allowable expense. Personal property, travel expenses. I just got the opportunity to send somebody with their caregiver to Disney for 3 weeks. Right? Can you imagine going to Disney for 3 weeks? That was an experience that they wanted, and their trust had sufficient funds to pay for it. So we were able to do that for them. Home modifications. We want our beneficiaries, we want our loved ones to live in our home, to live in their home for as long as possible. But maybe they just need a little bit extra, right? The flooring's not quite right. Or they need installs in the bathroom, or they need the cabinets lowered, or they need specialized doors. Whatever the case may be, a special needs trust can authorize a distribution for home modifications. Phone, cable, and internet service. The outside world is so important, right? We all need to connect, and we do that via the phone and the internet. And so we will, those things are allowable expenses. Hobbies and entertainment. I have several folks who we buy fishing supplies for, or we send them to art camp or to Artists First. We send to equestrian camp, or we buy beads and crafts and all of those things, right? Those are all allowable expenses. I will also authorize distributions for video game consoles. I get that question a lot. So an Xbox, PS5, all of that is allowed as well. And then the big question, actually the very first question I ever received about an ABLE account was, can you fund an ABLE account from a special needs trust? And at that time I said, I don't know. They haven't told me I can. Years have passed. They definitely told me I can. And so a special needs trust can make a distribution to enable account. That is a fantastic way to utilize special needs trust funds to supplement the needs of the beneficiary. And so before I move on to non-allowable, I want to talk just a few minutes about irrevocable prepaid burial policies. We have spent quite a bit of time here this evening talking about planning, right? We're going to plan for our loved ones. We're going to do this. We're going to find the right attorney. We're going to find the right trustee. We're going to have properly administered special needs trusts. We're going to protect those public benefits. And then what happens when Johnny passes? Right? If it's a first party or enable account, goes back to Medicaid. If it's a third party, it goes to whomever the donors want. Who pays for Johnny's burial? Right? And I know you're all thinking, well, I don't know, right? Or maybe you do know. My question then is, and the most important piece on this page, so we can talk about distributions and what's allowed and what's not allowed. The most important piece is irrevocable prepaid burial policies. It is so important. The trust turns off when the beneficiary passes. It is not available for their funeral expenses. So while the beneficiary is living, it may be incredibly difficult to go into a funeral home and plan a funeral that you don't want to plan, right? We've all been there. We've all planned the funeral we don't want to plan. But it is so important to get it paid for before the beneficiary passes away. We don't know what happens tomorrow. We don't know what happens next week. We don't want to leave that cost to somebody else. So please, please, please plan for those irrevocable prepaid burial policies. There is no upper limit in Missouri. You can have as much as you want in a prepaid burial policy. The number of times I have talked to family members that I've worked with for years and years, and they call me and they say, Johnny passed. Time to pay for the funeral, Casey. And I say, I'm so sorry, I can't. Right? The trust shuts off. So we want to make sure that we purchase an irrevocable prepaid burial policy while the beneficiary is living. Now, you can do that with funds that they may receive. Maybe your special needs trust is not the best option, and maybe you're not so sure about an Able account, but there's still this back payment. Purchase an irrevocable prepaid burial policy with it. It's considered an exempt asset. There's no upper limit, right? So do something with those funds that is going to benefit the individual going forward and doesn't burden somebody else with those costs at a time that is so very hard, right? So if we're going to walk away with allowable distributions, we're going to highlight that irrevocable prepaid burial policy. We're going to highlight medical and non-food. Those are the important things that a special needs trust can pay for. What can't I pay for? Oh, this is my not so fun list, right? So Social Security and Medicaid, they tell me, hey, Casey, you can administer these special needs trusts. They're beautifully written. You follow all the rules of distributions. We're learning all of the rules of distributions. And Johnny can have it as an exempt asset. That's great. But do not pay for housing. Do not pay for housing. And housing includes rent, mortgage, room and board, and utilities. Social Security has made it very, very, very clear. Special needs trust cannot pay for housing. If a special needs trust were to pay for the beneficiary's housing, there could be a reduction in the benefit. We don't want to reduce the benefit, right? We need that $943 a month. That's income. That's the beneficiary's income. So a special needs trust cannot pay for housing. Social Security says, we send you $943 a month. That's plenty of money. for rent. Your special needs trust can't be used for that. It is meant for your supplemental needs only. And because housing is an essential need, the special needs trust can't pay for it. I'm going to say the same thing about food, right? So food is also not an allowable expense because it's an essential need. You heard me say non-food. We highlighted non-food items, right? Food is not an allowable expense. Neither is cash to the individual. We talked about how income, we looked at the difference between what income and an asset is. We learned the difference of how much you can have an income and an asset for Medicaid and Social Security, right? Cash to the individual is going to count as income. So a special needs trust, because our ultimate job is to what? Is to protect the public benefits of the individual with a disability. Our ultimate job is to do that. And so if we're just paying out cash, that's not protecting benefits, that's impacting benefits. The special needs trust is for the sole benefit of the beneficiary with a disability, right? The sole benefit. So gifts to others. I would love to be able to buy all staff members, all family members presents, thanking them for their days, right? Thanking them for their time, celebrating all of the holidays that are out there. I can't do that. Johnny can't pay for the staff members' presents. Johnny can't pay for family members' presents. Johnny can only pay for Johnny. Right? As much as we love celebrating holidays and birthdays and providing gifts to others, Johnny's trust is for Johnny. That's it. These rules apply for both first party and third party. So I've had some questions over the years of, well, you're just talking about first party. Nope, I am talking about both first party and third party. I also added a bullet about some trustees. So you're going to find that some trustees have different rules in these certain circumstances. So gambling, weapons, and homes. I will tell you, Midwest Special Needs Trust does not purchase a home. We will not hold a home as an asset. We will furnish that home. We will support the beneficiary to live in that home, but we will not purchase that home. I don't know any trustee that's going to authorize distributions for gambling, but there's probably one out there. And then weapons are a liability. We're not going to purchase weapons. You potentially could find a trustee that would purchase funeral expenses after the death of the individual. It is more likely to be with a third party trust than a first party trust, though. So as much as I talk about irrevocable prepaid burial policies and the importance of planning and all of the things that we need to do, right? You still may find a trustee that is willing to make those expenses. However, they're also making the decision to potentially impact Johnny's benefits. So my list of allowable expenses is so much longer than my list of non-allowable expenses, right? My non-allowable are big, right? There's no housing, no food, no cash, no gift to others, no weapons, right? Some of those are really big needed things. And it's because the special needs trust is not for the support, the support of the beneficiary. It is for the supplemental needs of the beneficiary. So if we walk away from anything on this slide, you're going to highlight not allowable housing, food, cash, right? Housing, food, cash. Those are things I cannot pay for. Because if I do, I'm potentially impacting those benefits. That our purpose is to protect those benefits. Our purpose is to keep those benefits. And so as we move to the allowable distributions for the ABLE account, you'll see the difference, right? My first bullet on there is living expenses. That's all living expenses. Rent, food. They're called qualified disability expenses, QDEs. Rent does have to be, so if you make a distribution from the ABLE account in July for your July rent, you need to pay it. in July. Otherwise, it will count as an asset in August, but pay our rent, our living expenses, education expenses, housing, transportation, employment, training, assistive technology, personal support, health, prevention, wellness. All of those are things that a special needs trust can do, right? My chart at the very beginning, my icons looked very, very similar. You can also pay for, so they added financial management and administrative services. Those are related to the ABLE account. Those are the fees included in their list. You can pay for legal fees, oversight and monitoring of the ABLE account. And then the ABLE account does allow for funeral to be purchased with funds after the beneficiary dies. So we talked about irrevocable prepaid burial policies, trust shut off, right? There's no purchasing burial costs at the time of death. If the beneficiary has an ABLE account, you can utilize those funds for that. Absolutely. So again, we learned all about special needs trusts. We learned all about ABLE accounts and how they were different, but the same purpose, right? So the same thing is here. They're different, serving the same purpose. The highlights here, the highlights of allowable distributions from an ABLE account include living expenses and housing. So the question I always get, somebody's going to raise their hand. I know it. I know somebody's thinking of it. They're saying, so you can make a distribution from a special needs trust to an ABLE account and pay rent? Yeah, absolutely. Fantastic way to utilize funds, right? So we make distributions all the time to an ABLE account. I have folks call me January 2nd and they say, Casey, it's time for my ABLE account distribution. And I say, okay. And they use those funds for the whole year to pay their living expenses while still receiving their SSI, right? And their Medicaid. So it is a fantastic tool. And I probably said it before, it is a fantastic tool for everyday living expenses, for everyday qualified disability expenses. You can pay your rent, you can pay your living expenses, you can pay for all of the things that somebody needs, right? It's different than the special needs trust. There are some bigger limitations on the special needs trust, right? So we have special needs trust, pay for medical, non-food items, travel, transportation. Compared to the ABLE account, we pay all of our living expenses, including our housing. But when we think about it and we take a bird's eye view and we say, well, the special needs trust doesn't have an account balance limit and SSI is not suspended and there's no Medicaid payback with a third party, but ABLE account, beneficiary gets to do it themselves. They get to make decisions. There is this maximum account value and SSI is suspended at $100,000. But the distributions are a little bit different. So we really want to lean back and we really want to look at what is the purpose of the funds in each account, right? What is the purpose? What are those funds going to be used for? Are the special needs trust funds going to be used for super really large big ticket items? And the ABLE account fund's going to be used for living expenses. Are you saving for college? Are you utilizing the intent of the ABLE account, which was under the 529 plan? And so you're saving for the future with your ABLE account, knowing that SSI is suspended at $100,000 and there's a cap of 529,000, right? Or are you looking at a special needs trust and you're saying, well, he's not going to need it for a really long time, so I'm going to fund it at my death. I'm going to put all of these funds over here for his medical expenses and his non-food grocery. He'll get to go to Walmart and buy all of the things he needs every month. And we're going to pay for his caregivers and all of that. And he's going to have these funds available for these types of things. And that special needs trust is going to make distributions to the ABLE account every year for these types of things. So when you're looking at your plan and you're trying to decide which is better or which is going to be the most suitable for your situation, really boil it down to its details, right? Really boil it down to the ABLE account has some fantastic things, right? The distributions from ABLE accounts, that list is amazing. Some limitations on some other things. Then you have a special needs trust, right? And it's amazing in its own way. It's been around longer. People under attorneys have to write the documents. There's laws and rules and regulations regarding it. The distributions are a little bit different, but there's no account limit, right? So which is going to be better and how are we going to utilize it? So as we talk about special needs trust and ABLE accounts, we're going to walk away with the one thing that I want to walk away with, right? We're going to walk away with knowing that a special needs trust and an ABLE account, their distributions, so as long as the distributions are qualified disability expenses or allowable distributions from a special needs trust, they're properly administered, the special needs trust is properly written. It's going to protect the individual with a disability's public benefits. It's going to protect the public benefits for an individual with a disability. However you want to say that sentence, we are going to walk away with that, right? They're going to protect Medicaid, Social Security, SSI, food stamps, and HUD housing. Right? We learned Medicaid and SSI, they have different income limits, they have different asset limits. They provide a couple of different benefits, right? SSI is a monthly check. Medicaid provides different benefits like housing and healthcare and transportation and all of the wonderful things. And we know Johnny needs those things. He needs to have that, right? So we're looking and we're saying, okay, well, here's a first party or here's a third party trust. It's really wonderful. It's so well written. Trustee is going to know what to do with it. They're going to make fantastic distributions. And you have an ABLE account over here. Fairly new, doing great. Love the ABLE account. Now, what are those funds going to be used for? And so we look at our distributions and we pull up that quick T-chart, right? And they say, oh, she said I could do this with an ABLE account and this with the special needs trust. Okay, what's our plan? Right? Because ultimately, our plan is to protect the benefits, the public benefits of an individual with a disability. And my note here is the personal financial situation of the individual and the specific circumstances will determine which is the most beneficial or if the answer is both, right? We learned special needs trust can fund an ABLE account. It's a fantastic way to utilize funds because you can make a distribution from a special needs trust to an ABLE account and pay for living expenses. All of the programs, all of the public benefit programs, all of the means tested benefits say that's fine, right? So what are we walking away with? And before we answer questions, and I know I've said it 100 times, I'll say it 100 times again, right? The thing we are walking away with today is that a special needs trust and an ABLE account, while different, serve the same primary purpose, which is to protect the public benefits of an individual with a disability, right? They may have different distributions, they may have different rules, there are different kinds, all of the technical details of it, but they are ultimately going to serve the same purpose, which is to provide to be an exempt asset for individuals with disabilities and protect their public benefits.
So someone asked, in order to keep a checking balance low, which is better, the special needs trust or ABLE account?
Honestly, for a checking account balance, I would recommend I would recommend an ABLE account because it's likely not a significant amount of money to kind of keep that special needs trust up and going. So I would recommend an ABLE account.
What is the reporting like for deposits and withdrawals from an ABLE account, and how do taxes come into play for deposits and withdrawals?
Yeah, I think that's a great question. So the ABLE account monitors deposits. So if you deposit more than 18,000 into one ABLE account, they're going to kick it out unless you show them that it's wages, right? So they are monitoring deposits. They are not monitoring disbursements. So you can request checks, you can put it on a card, you can do where however you want the funds issued, they'll issue it for you. No one is telling you you can't do that. Right, so we always want to keep receipts. That's my recommendation. Make sure it's for a qualified disability expense that you can justify that expense from a special needs or from an ABLE account. Taxes, I believe they send out similar to a 529 plan. They send out whatever they send out for a 529 college savings plan is the same thing they send out for an ABLE account. But my guess is that the income to the ABLE account, because it is an investment account, is taxable. And so it is, it does then go to the owner of the account.
What role do you play where you were able to allow the distribution of the 3-week Disney trip? Are you the trustee, or do you mean you were able to approve the distribution, you as special needs?
Yeah,
Midwest
so
Special Needs?
I serve as, so my organization is Midwest Special Needs Trust. We serve as trustee, and my role within the organization is Director of Trust Services. So Midwest Special Needs Trust is a nonprofit trustee where we make decisions regarding distributions and all administration. So when I say I really am saying Midwest Special Needs Trust. As an organization of trustee, we made the decision to authorize that distribution.
Thank you.
Mhm.
How difficult is it to set up an irrevocable prepaid burial?
Not difficult at all. So when I tell folks that they need to do this and they're ready to have that conversation, I tell them to go to the funeral home and ask for a Medicaid compliant policy. If you go in and you say, I want an irrevocable policy, they may not know that you're trying to get it to be Medicaid compliant. Right, so you're going to go in and ask for a Medicaid compliant, and most funeral homes have somebody dedicated to that, just to do those. And then if they have questions about how it should be written, there isn't an upper limit. You can put whatever you want into that policy, and you can actually make payments on a policy as well. So it's not that difficult. It takes a little bit of time. It's a difficult conversation and a difficult thing to do in itself, but the actual part of it isn't difficult.
That's great to know. All right, we have a few more. Can the Special Needs Trust pay for medical insurance premiums?
Absolutely. Yeah, sure can.
Great. Did the Social Security Administration recently relax the limitation using SSI for food?
Oh my goodness. I love it. Right. Somebody's paying attention. Yes. However, no POMs have no rules have been issued for food. So I am still saying no food until I have some very, very well-written rules from Social Security that tells me that I can start paying for food. What you'll find among the special needs trust world is that it is so new and so unique that Social Security has said, yeah, food no longer counts as income. That we're all not quite sure what to do with that piece of information yet. So the standard is to that no, we're not going to pay for food until Social Security comes out with their set of rules regarding that. But yeah, they changed on September 31st of this year. I
Right.
love that somebody paid attention. That's great.
Yeah, we've got folks really doing their
Yeah.
research. Do the non-allowable expenses apply to someone who receives SSDI?
No. Good
Okay.
question. And I don't, when I speak, I don't go into the technicalities of the SSI versus SSDI. We're assuming that we're all looking under the SSI rules. But yes, you're correct. The non-allowable does not apply to those receiving SSDI.
Thank you. Well, that is the end of the Q&A. Casey, do you have anything else to add?
No, if we're
Those?
gonna keep our highlighters and pencils out, highlight my, our email address, our website. And, thank you so much for your time this evening. I appreciate it.